Dr. Sameer Gupta. I am the Professor and Head of Department of the Surgical Oncology at Patil Medical College, Pune. I would like to make you aware about cancer and how we can diagnose it early. First, I would like to tell you what are the causes of cancer. That is, what are the things which can cause cancer in a person. So, the most important in our country is tobacco. Consumption of tobacco leads to cancer in a large number of people in our country. Second is consumption of alcohol, and combination of tobacco and alcohol leads to a deadly combination. Third is infections like human papilloma virus infection. This leads to cancer of the cervix in women. The other things which are important are a sedentary lifestyle, which leads to obesity or increased weight, and which leads to various cancers which I'll talk about later. And of course, we cannot discount the presence of pollution, which has increased manifold in the country these days, and which contributes to a large number of cancers. According to the WHO, it has been predicted that the number of cancer cases in our country is going to increase by almost 75% in the next 10 years. This is predominantly because of these various habits which we have acquired as our modern fast-paced life overcomes us. Alcohol, tobacco, lack of exercise, and of course the use of the various pollutants in the food we consume. Cancer can be prevented first of all by avoiding tobacco and alcohol, which is of course very important. Secondly, we should have an active and healthy lifestyle. We should do at least 30 minutes of active aerobic exercise every day for 5 days a week. The body weight of a person should normally not be above 10% of the recommended body weight. For this, a diet which is high in proteins and low in carbohydrate and fat is highly recommended. We should also have large number of fruits and green vegetables, because this leads to increased number of vitamins which are helpful in preventing cancers. Often find that many of the patients come at a very late stage of cancer to us when they are beyond treatment and cure. And the reason for this is that many of the patients go to traditional doctors or they go to alternative sources of medicine, and that is why their disease is not diagnosed early. So my recommendation and advice to all such patients is that the moment they know that something is amiss, they should consult an oncologist as soon as possible and come to the correct place for treatment. As most of us have such a fast-paced life, many times we delay going to a doctor. But however, we recommend that to prevent certain cancers, a regular checkup should be done. For women, a breast mammography should be done after the age of 40 every 5 years. And for women also, to prevent cervical cancer, a pap smear should be done yearly after the age of 20 years. For males, for prostate cancer, a PSA examination should be done after the age of 50 years. So every year we see about 2,000 to 3,000 new cases of cancer, and we are able to treat almost about 70 to 80% of them successfully. However, my hope and wish is that more patients come at an early stage so that we can treat them successfully and give them a cancer-free life. And for this, I want that most patients should undergo screening for cancer like breast mammography or pap smear, regular visit by their doctor, and so that they can get detected early. Let's come together and make India cancer free.